this is a pillow that we use for pregnancy. You'll see that there's actually a hole in here for the belly. So when mom lies on the table, her belly will go right into that, which allows her to sleep on her belly. And then we'll raise parts of the table so that she's comfortable on the table. One thing I want to show is when we do an adjustment in our clinic, we use tables that have a drop, so it goes up and goes down. And so it makes a loud noise, but you can see the movement of it here. It goes up like this, and then it'll go down when we press. So that's what I'll be doing as I go through the adjustment, is pressing certain parts with the table, and other parts I'm holding pressure simply with my fingers or my thumb. All right, hop on, madam. Is that good there? Beautiful. So a lot of the analysis we do is for the pelvis. I don't know if you can see from here, but we push both feet forward and they're not equal. One goes further, one gives more resistance. So it starts to give us some information about what's going on in the pelvis. And there's equal. Okay, just gonna check right by the tailbone, okay? So there's certain things we check for, and if they're not positive, we don't do them. Okay, and then you can turn onto your back. Okay, so you can pass me your hands. Okay, we're checking good balance of the body side to side with that. And a lot of times the hip muscles are tight. So for that, usually we hold some pressure. Sometimes we use the table there as well. And then we always check the pubic bone, which is an area that's very sensitive in pregnancy, because a lot of pressure holds on there. And lastly, we check one of the ligaments, the round ligament. That's good. Yeah. Okay. And that's how we check for pregnancy.